Dr. Sheldon, this is Kim asking you to make your comments on my video pertaining to my right knee. This is Wednesday, about 3 days after I injured it. I jammed my knee into the ground, or well, not my knee, but I jammed my foot, driving the force from my lower leg in through my knee up into my femur after a hay bale was starting to tip and roll over, and it was only a one hay bale high, and anyhow I jammed my leg and gone to orthopedics, going to get an MRI. X-rays were clean. They said everything was fine. I don't deal with arthritis now. Part of my team here is Dr. Sheldon, my chiropractor, who's worked on me for several years. Go ahead, Dr. Sheldon. You've just examined my leg. Please state what you'd like to state.
So we did some different exams on her, orthopedic-wise, and check in ligament laxity and things like that. So, medial joint space of her knee, there's definitely some swelling and edema, which overall it sounds like her knee was a lot more swollen than it is today. She's done a little better that way, but definitely some swelling in the medial joint space. There's a lot of point tenderness over the distal end of the bicep femoris there, and difficulty bringing that knee into flexion. Drawer test, both anterior and posterior are okay. Varus valgus is okay. On the back side, popliteus and soleus are definitely in a spasm down the back of her leg there. And then there's a little bit of inflammation on the back side of that fibula head. So, to me it looks like she's definitely aggravated the tibia. When she jammed that, it looks like the tibia has just a little bit of posteriority there. So hopefully we can move that a little bit and get her back to feeling as good as she was before this.
Yeah, because I can't feel like I can get my femur, to take my femur, or where my quads are all swollen above my knee. Like I can't get my femur to go back down fully because the tibia is not where it's supposed to be, so the femur doesn't. I can't feel like I can even get any of my normal range of motion of hyperextend. Well, I don't have hyperextended knees, but my range of motion definitely goes beyond neutral on me, which is normal. I can't even get there. And if you try to flex my knee, then I have horrible pain right on the lateral side. Immediately grabs right behind the fibula head, kind of whatever you would call it, right on the left.
Especially that into that bicep femoris.
Right, absolutely. That part of my knee has been the worst spot of the most horrific pain, and now I'm feeling pain secondary. I did not have pain on the medial side when this injury first happened. Now I'm feeling it medially also, but from the beginning it was always the posterior lateral corner where my pain was. So you adjusted my leg, and what was the adjustment that you did, and how what did you feel?
Yep, so we set that proximal tibia posterior anterior, and it's in a proper weight, does allow your weight bearing, and so she already can get a little more flexion out of that knee there. So as time goes on, we'll see in the next few days how she does.
Okay, and we'll see
on that and what the knee looks like next time we see her.
Okay, in the meantime I'll get the MRI so we'll know if we've truly damaged anything internally, and then I'll come back and see you in a couple days to see if we need to reset it again or how's it doing. Okay, thank you so much for your help, Dr. Sheldon.